role of your local pharmacist, it is changing. He or she will soon be able to step in where your primary care doctor normally would. News 5's Lauren Wilson in the newsroom right now. Lauren, the changes could save us time, could save us money.
The new Ohio law could literally cut your patient visit time and cost in half, and even the amount of daily medications you take. It's a move many states are taking right now to make healthcare more efficient.
I think we know that in America we have imperfect healthcare delivery.
Even so, when T.J. Grimm became a pharmacist 25 years ago, he might not have known then his career would have morphed into this.
Pharmacists can be a real cheat code for healthcare costs.
A new Ohio law says health insurance companies can now pay your pharmacist for doing some of the things your doctors would do.
I appreciate that.
Like tests for sinus infections, strep throat, diabetes, and other preventative screenings, and medication consultations.
The biggest factor that determines whether or not a patient will take their medicine is having a relationship with their pharmacist.
One of the main drivers behind the law.
Patients do not often take their medicines, and in the underserved communities in particular, it's very bad.
The 2015 Journal of Hospital Medicine showed a pharmacist's involvement with patients has a positive impact on their overall health attentiveness and decreases hospital visits.
This gives pharmacists an opportunity for more of their day to be spent in direct patient care.
Certainly the pharmacists that are based in hospitals and in medical care centers, it makes sense there because you're part of a larger team.
The new law is one that political analyst Tom Sutton says is growing in popularity among many states and satisfies both parties.
This is really where the two sides get to come together, but it's producing the kind of results that both sides want to see. Lower costs, more access for more people.
There is concern, however, about the amount of work this now puts on the pharmacists.
The demand issue is definitely a problem. It's definitely a challenge. Really, the only way to handle that is to try to find ways to open up access for more people to go into this field.
The law goes into effect this April. Now, Ohio State University is a good example of making this idea work. Pharmacists have already been brought in as members of the healthcare team versus standalone entities. Now, similarly, UH hospitals say they plan to almost double their pharmacy staff and will block off specific rooms for medical consulting. Lauren Wilson, News 5.